For centuries, there were two distinct schools of thought when it came to health and healing. Western medicine, with its emphasis on ridding the body of illness through the use of medication and other interventions, and Eastern healing, which centered on a more spiritual or holistic approach. But over the last few decades, there has been more acceptance that science and spirituality can work together. Dr. Shamini Jain is a psychologist and author of the new book, Healing Ourselves, Biofield Science and the Future of Health. She joins me now. Dr. Jain, what a delight to meet you.
It's so great to meet you, Michaela. Thank you so much for having me.
You're a psychologist, a scientist, and someone who has worked so much and in this space of holistic health. Maybe start by explaining to us and defining what biofield science is.
You bet. Biofield science is really, to me, some of the most exciting work that's being done in science. We're studying fields of energy and information that guide our health and healing. And this isn't as mysterious as we think. We've actually known about biofields for some time. So when we measure, for example, the heart rhythms with the EKG, it tells us about the state of our heart health. And the same thing with the EEG, where we study our brain waves. So that's part of biofield science, where we're studying those fields. We're even learning how we can put energy into the body to foster healing. So, for example, we're using focused ultrasound to help reduce tremors in Parkinson's disease. And we've known for years about laser therapy and its effects on reducing inflammation and pain in the body. But then there are those subtle aspects of the biofield too, which we're studying in health and medicine. And that includes looking at things like prana and chi that have been described in generations for millennia. So we have healing practitioners that say, I work with prana and chi. That's what I'm doing when I do acupuncture or Reiki or healing touch. And then the question is, well, do those therapies really have beneficial effects on patients? We're learning that they actually do.
You know, it's so interesting for so many of us. We know that it has been, it has felt like a choice, right, between science and spirituality. But you say, no, it's and, not or.
Absolutely. What we know from science is that the body and the mind and the emotions are interconnected. We've learned more and more about this over the past several decades, and it turns out that our energy is connected too. So it's really not an either or, because we're whole beings. And so we're moving toward what we call whole person medicine that honors the role of the spirit, the emotions, our connection with our environment and people, and our diet. All of these things can bring really powerful healing effects to us. But that doesn't mean that we don't have to take physical medicine either, because we're physical beings too.
Yeah, these are physical manifestations of life, right? I want to talk about the placebo effect. Most of us are familiar with the idea of a placebo effect. We hear about it all the time. You actually say it's a good argument for the power that we all do possess to heal ourselves.
Absolutely. When we look into placebo effects, which we find across all kinds of medicine, whether we're looking at drugs for pain or depression, we even find strong placebo effects in surgery. So when we look at those, what it's telling us is that we have tremendous power over our healing. And healing here is the restoration of harmony. It's not just getting rid of a disease, although that does happen. But when we go into a situation with a positive mindset, harmonize our relationships with the doctor, for example, and really know what illness means to us and what health means to us. All of those factors will really up-level our healing process. There's so much data behind it.
Well, it's interesting because I think of late more and more people have heard even things from their general practitioners, Western medicine doctors, about incorporating, say, yoga or meditation into their lifestyles. That's not something they would have said 20, 30 years ago.
It's true, and this is great. This is why it's so important to invest in the research for mind, body, spirit practices, including yoga, meditation, and even things like energy healing, where we're seeing profound effects. What we know now is that the American College of Physicians actually recommends yoga and meditation as first-line treatments for things like chronic low back pain. And that's because of the evidence. What we've learned is that whether you're practicing Tai Chi, Qigong, different kinds of meditation, yoga, all of these seem to have beneficial effects on reducing anxiety, reducing pain, and even influencing our immune system. So we're understanding the physiology of how this works. And they're more similar than different in many ways, which means that we get to choose. We get to pick a practice that we love and work with it and see the benefits.
Quickly, indulge me on a question about the vaccine, because it's the biggest debated topic right now. And I'm just curious your thoughts on it, because this is a place where one would think the paths might be divergent.
Well, they could be, and opinions are all over the map on this. What I can say is that if you are deciding that you want to get the vaccine, you haven't yet, and you're nervous about that, first of all, let's own that, okay? It's normal to be nervous if you're going to go and get the vaccine, because many people are. It's new, and there are all these things. But what we can learn from placebo research is that we can actually harmonize a positive outcome if we are going to go and get the vaccine and we haven't yet. So here's some specific things we can do. We can go before we get the vaccine and do something we love to do. We literally want to get our joy juice flowing because we really want to mitigate the effects of anxiety. We know that placebo effects, which are positive expectations of outcomes, can really help harmonize the mind-body system. So if you're going to go, do something fun that you enjoy, and then allow yourself to simply say, whatever medicine is in this vaccine that's going to help me fight the virus, help my immune system fight the virus, let it come into my body, and anything I don't need, let it release from my body. You'll actually find that you can energetically release anything that you don't need from any medicine.
Yep, prayer works that way too, isn't that something? Dr. Shamini Jain, pardon me, what a delight to speak with you and just put some different ideas into people's minds around the context of this conversation. I like the idea it's and, not or, science and spirituality. I love that we got to go there a little bit on the show today. We'll call on you again. I'd love that if you'd be willing.
I would love that, Michaela. Thank you. There's so much to explore, and it's an honor to be here with you.
The delight was ours. Thank you so much. I want to remind you that Dr. Jan's new book, Healing Ourselves, is available wherever you find your books. Thank you so much, Dr. Jan. There's a cover right there. And for more information on Dr. Jan's work, she founded a nonprofit called the Consciousness and Healing Initiative. You can check that out at www.chi.is.